Hello dear friends, this is a case of an acute abdomen. It is a case of a 90-year-old woman who presented with significant abdominal pain, vomiting, known to have a large left inguinal incisional hernia, and presented with symptoms of bowel obstruction. Indeed, the CT scan showed small bowel dilatation with air fluid levels. But there are it's a complex case, so I will show you all the findings one by one. First of all, there is a left-sided inguinal hernia containing a small bowel loop. It is a small bowel loop. Okay, why? Because if we follow the large bowel, we can see that it is free and it is not involved. Here is the descending colon. I will scroll down again to see. This is the large bowel. Okay, the sigmoid colon here. Okay, so this is a small bowel loop in the left inguinal hernia. As you can see, beyond this point, the large bowel is collapsed in the periphery. Okay, slightly collapsed. But on the other side, proximally, the dilatation starts. Okay, so this hernia is complicated. It's incarcerated. But there is another set of findings here. As you can see, there is fat stranding, significant fat stranding, which is suggestive of ongoing inflammatory changes. There are traces of fluid here and there. Here, all this is fluid. Here is a quite big collection in this region. Don't be confused with bowel loops. Okay, there is no physical continuation of this structure with any of the gastrointestinal tract and small or large bowel loops. Okay, probably this is a collection with air fluid level, but it's very difficult to be differentiated, to be honest. Okay, this is another collection here. So in a few words, there are some ongoing inflammatory changes. Now, if we go to the right colon, let's start from the right colonic curvature here. Let's go down. Here it looks normal, just fecal loading. Here, and from that point up to the ileocecal valve, which is here is the terminal ileum. Okay, there is a connection between the cecum and the terminal ileum. So here is the ileocecal valve. Okay, there are some inflammatory changes. All right, and exactly here there is a tubular structure in this point, arising from the cecum. So this is highly suggestive of appendicitis, which is complicated with inflammatory changes, collections, but in the differential diagnosis we can include some other inflammatory source or pathology or even malignancy given the age of the patient. Another point is that due to the secondary inflammatory changes of the terminal ileum, there is luminal stenosis here, and this contributes to the small bowel obstruction, or at least reduced outflow. So this is a complex case, and some of the learning points here is that when we see one finding, we have to exclude another one. So in conclusion, there is small bowel obstruction associated with left inguinal hernia, which is definitely incarcerated because the involved small bowel loop is dilated, and there is dilation proximally to that point, and there are ongoing inflammatory infectious changes in the pelvis involved with free fluid and locules of fluid and collections, and there is definitely involvement in the region between the cecum and the ileocecal valve, and of course the appendix. Thank you for watching. Please subscribe to my channel if you find my videos interesting, and see you the next time.